Okay, let's jump into a topic that might sound a bit technical, but it's actually a really common thing dog owners run into. We're talking about canine vaginitis.
Yeah, and we've got quite the stack of sources here. You've gathered articles, research papers, all looking specifically at this condition in female dogs.
Right. So our mission today is to really dig into these sources with you, the listener, pull out the essential stuff and help make sense of it all if your dog ever deals with this.
It's basically inflammation of the vagina, and the sources are clear. While it's common, it can be anything from like a minor irritation to a sign of something bigger going on.
So let's start right there. What is canine vaginitis, fundamentally?
Well, at its core, it's just that inflammation of the vagina in female dogs. And the sources point out it can pop up in any female dog, any age, any breed, spayed or not.
Okay. Inflammation sounds simple enough, but you mentioned it can be more than just uncomfortable.
Oh, absolutely. It can cause real discomfort, leading to signs you definitely notice. And sometimes, as we'll see digging into these sources, it's actually a symptom pointing towards a deeper underlying health problem.
Gotcha. Okay, so who tends to get it, and what are the signs we as owners should be looking out for?
The sources really break it down into two main groups, mostly based on age. First, there's juvenile vaginitis. This usually affects young puppies before their first heat cycle, so typically between maybe 6 weeks and 8 months old, sometimes up to a year.
The little ones.
Exactly. And then you've got adult onset vaginitis, which, like the name suggests, affects dogs over a year old. And how vets look at it, the causes, can be pretty different between those two groups.
Okay, and what are those signs that might make you think, something's not quite right down there?
Well, the most obvious one is usually vulvar discharge, but it's not always the same. The sources describe it varying a lot. It can be thin and watery or thick like pus, and
And the color.
colors can range too clear, white, yellow, green, sometimes even tinged with blood. The amount can vary, the smell can vary.
So anything from just a little bit of moisture to something, well, much more obvious.
Precisely. You might also see your dog licking her vulva way more than usual, or maybe scooting her rear end on the floor.
Ah, the scooting.
Yeah. Or you might just see that the area around the vulva looks irritated, maybe even crusty.
Sounds pretty uncomfortable for the poor dog.
It definitely can be. And for adult dogs, sometimes the signs can bleed over into the urinary system because, well, everything's so close together anatomically.
Right.
So they might show signs like straining or pain when they pee, that's called stranguria, or needing to go out more often, which is polyuria. And the sources mention that in more chronic or severe cases, there can even be links to things like urinary incontinence or, for breeding dogs, fertility problems.
Okay, so if we see those kinds of signs and head to the vet, what are they looking for in the exam?
Well, they'll do a general checkup, naturally, but they'll really focus on the external genital area. They'll look closely at the vulva itself, checking for redness, any swelling, discharge, maybe staining on the fur around it.
Is there anything specific about the dog's anatomy they're checking?
Yes, a really key thing they assess for is what's called a recessed vulva. This is where the vulva is kind of tucked up inside the surrounding skin folds, and as we'll get into, that's a super common underlying factor.
Oh, okay.
And for bigger dogs, they might also do what's called a digital palpation, gently feeling inside the vagina with a gloved finger to check for any structural weirdness like narrowings or masses.
Makes sense looking and feeling. Now, based on these sources, the really big question seems to be, why does this even happen?
Exactly. And this is where the deep dive really starts, because figuring out the why is absolutely critical for deciding on the right treatment. The sources generally split the causes into primary and secondary.
And secondary are more common.
Way more common, yeah. The sources really stress that.
Okay, so let's tackle the less common primary causes first.
Right, so juvenile vaginitis often fits here. In a lot of those young puppies, they don't really pin down an exact cause. It might just be related to their anatomy being immature, or maybe their local immune system isn't fully developed yet.
So it's kind of like growing pains.
Sort of, yeah. And the good news that the sources consistently highlight is that it very, very often just resolves all by itself after the puppy has her first heat cycle and those hormones kick in and change things.
Ah, so time is often the cure there.
Frequently, yes. Patience is key. Another less common primary cause mentioned is viral infections. Canine herpes virus, or CHV, is listed as one possibility that can directly cause inflammation.
Okay, so primary is often developmental or a direct infection, but not the usual story. the secondary causes are where the action usually is.
Absolutely. Secondary means the vaginitis is happening because something else is going on, creating the problem in the vagina. And the most common thing we see as a result of that underlying issue is a bacterial infection.
So does that mean bad bacteria just move in?
Well, it's a bit more complex. The vagina normally has bacteria, what we call the normal flora. It's supposed to be there. But if the local environment changes, maybe it gets too moist or irritated, or maybe something's physically trapped, then those normal bacteria can overgrow, or other bacteria, often ones from the skin nearby, can kind of seize the opportunity and move in.
Opportunists.
Exactly. The sources list common ones like E. coli, staph, strep, proteus. But the really key insight here is that the bacterial infection itself is usually secondary. It's happening because something else created the right conditions for those bacteria to go wild.
Ah, okay. So the bacteria are just taking advantage of a situation that something else created.
Precisely. And that something else is very often related to anatomical abnormalities.
Like that recessed vulva you mentioned. Is that a big one?
Oh, it's a huge one, especially for chronic recurring problems. That tucked-in vulva creates skin folds right around the opening. And those folds can easily trap moisture, little bits of urine, skin debris, basically turning the whole area into this warm, damp incubator, perfect for bacteria and ongoing irritation. It's like a little pocket that just never really airs out or dries properly.
That makes perfect sense visually. A little trap.
Exactly. Other anatomical things mentioned include vaginal strictures or bands. These are actual narrowings inside the vagina that can physically block the normal outflow of discharge or even trap urine. And also vaginal hypoplasia, which means the vagina itself is underdeveloped.
What about things upstream, like the urinary tract? You mentioned the connection.
Yes, that's a really important link. Urinary tract issues are definitely listed as significant secondary causes. A straightforward UTI, a bladder infection, can easily let bacteria travel down the urethra and into the vagina, setting off inflammation there too.
Makes sense.
Or if a dog suffers from urinary incontinence, meaning she leaks urine, that constant exposure of the skin around the vulva to urine scalding is incredibly irritating and creates an environment just begging for infection to take hold.
So anywhere urine or bacteria can pool or easily travel is a potential problem spot. Now, you mentioned something in the sources about foreign bodies.
Yeah.
That sounded intriguing.
Ah, yes, foreign bodies. Things actually getting stuck inside the vagina. This section in the sources can be, well, a bit surprising.
Like what? Grass seeds.
Yeah, things like grassons, foxtails, little bits of plant material, maybe debris from mating. Those are possibilities. But the sources also specifically mention more unusual things, potentially including, get this, retained tampons.
Wait, what? A tampon? In a dog? How?
Well, the implication seems to be if an owner used one, perhaps for managing discharge during heat, and it wasn't properly removed, it's listed as a potential, if probably uncommon, cause of severe irritation and secondary infection.
Wow. Okay. That's definitely not something I would have ever thought of.
It really just underscores why a thorough investigation is so crucial. You can't assume anything. Other causes listed include trauma, maybe from rough mating, or a difficult birth, what they call dystocia, or even self-trauma, where the dog is licking the area so excessively because it's itchy or irritated that she makes it worse.
That makes sense, too.
Then there's neoplasia, which means tumors growing in the vagina. Things like benign growths called leiomyomas, or malignant ones like transmissible venereal tumors, or TVTs. These growths themselves can cause inflammation, discharge, and make the area prone to secondary infection.
Okay.
And also conditions like vaginal hyperplasia or prolapse, where the vaginal tissue itself swells up or even sticks out. That exposed, swollen tissue is just really vulnerable to irritation and infection.
So it sounds like the big picture insight here, especially for adult dogs, is that vaginitis usually isn't just some random bug appearing. It's more often the body's reaction because something local isn't quite right. The anatomy's creating a trap or something stuck, or there's irritation coming from somewhere else like the urinary tract.
That's a perfect summary. The sources hammer home that need to find the underlying issue. They also mention a few other less common contributors, things like allergies, maybe food or environmental, affecting the skin around the vulva, or irritation from chemicals like harsh soaps or douches, which owners should definitely avoid. And, very rarely, certain systemic diseases might play an indirect role, perhaps by affecting the immune system or overall skin health.
And they also flagged risk factors, right? Like that recessed vulva we keep coming back to. Obesity, maybe the dog's general conformation, and even things like previous antibiotic use, possibly messing up the normal bacterial balance down there.
Exactly. All things that can make a dog more susceptible. So, yeah, the main takeaway from the causes section has to be, for adult dogs especially, you almost always need to look past the inflammation itself to find the real root of the problem.
Okay, given that whole long list of potential whys, how does a vet actually figure out which one is causing the problem in a specific dog? What's that diagnostic journey look like?
Yeah, the sources are really clear on this. You need a thorough, step-by-step approach. You can't just, take a wild guess.
And it starts with talking to the owner,
Yeah,
getting the history.
always. A comprehensive history is absolutely step one. The vet needs all the details. What signs have you seen? Exactly how old is the dog? Is she spayed or intact? What's her heat cycle history been like? Any past issues like UTIs or skin allergies? Even stuff about her diet or environment can be relevant.
And then the physical exam we talked about earlier.
Right, checking her overall health, but really zoning in on the external genitals, including that check for a recessed vulva. But the real turning point in the diagnosis often comes with the vaginal examination itself.
Is that just the digital palpation you mentioned? Feeling inside?
That can be part of it, especially in larger dogs, but the sources really spotlight vaginoscopy as being the most critical diagnostic tool here.
Vaginoscopy, that's using a camera.
Exactly. It involves using a special endoscope, basically a tiny camera, often on a flexible tube, to actually look inside the vagina directly.
Getting eyes on the ground, so to speak, right inside.
That's a great way to put it. It lets the vet see the vaginal walls up close, how inflamed they are, if they're red or swollen, where the discharge is coming from. And crucially, it allows them to directly identify anatomical problems like those strictures or bands, or see if there's a foreign body stuck in there, or spot any tumors. It gives visual proof that you just can't get from a swab alone.
Okay, so that direct look is key for spotting structural issues or foreign objects. What about lab tests? What do they tell you?
Vaginal cytology is super important. That's where they take a swab from inside, roll it onto a slide, and look at it under the microscope.
What are they looking for there?
They're looking for inflammatory cells, primarily neutrophils. Seeing lots of those confirms there's active inflammation. They also look for bacteria or yeast, or there are loads of them. And they look at the types of epithelial cells, the cells lining the vagina, which can actually give clues about the dog's hormonal status, like where she might be in her heat cycle.
And remember, the sources made a specific point about finding bacteria.
Yes, and this is crucial. The vagina isn't sterile. It has normal bacteria living there. So just finding some bacteria on a cytology slide or even growing some on a culture doesn't automatically mean that's the cause of the vaginitis.
Right.
The cytology helps interpret the culture. Seeing lots of inflammatory cells alongside the bacteria gives you much more confidence that the bacteria are actually involved in the problem. And if infection is strongly suspected, then they do a bacterial culture and sensitivity test. This uses a special sterile swab, often one with a guard on it, to get a clean sample from deeper inside.
And that tells you not just which bacteria are present in significant numbers, but critically, which specific antibiotics will actually work against them.
Precisely. Absolutely essential for choosing the right treatment and avoiding guesswork. And given that close link to the urinary system we discussed, doing a urinalysis and a urine culture is also considered a really vital step. You have to rule out or identify a concurrent UTI because that could be causing the vaginitis or at least contributing to it.
Makes sense. Any other tests they might run?
Yeah, depending on the case, they might recommend general blood work to check for any underlying systemic illness. And a brucellosis test is important, especially for intact dogs intended for breeding, as brucella infection can cause reproductive tract inflammation.
What about imaging, like X-rays or ultrasound?
Sometimes. An abdominal ultrasound can be really useful. It lets them look at the uterus, making sure there isn't a pyometra, which is a serious uterine infection that can cause discharge mistaken for vaginitis. Ultrasound can also help visualize the bladder better and sometimes see masses associated with the vagina. Less commonly, they might use contrast radiography using special dye with X-rays to help outline anatomical issues like strictures or abnormal connections called fistulas.
Wow, okay. So it's really a methodical process of elimination and confirmation to pin down that underlying cause. And once they have a good idea of the why, then they can talk treatment.
Exactly right. The sources all emphasize this. Treatment must be tailored to the specific underlying cause they found during that diagnostic workup. Just treating the inflammation itself won't fix the problem long term if there's, say, an anatomical issue or a foreign body still in there.
Okay, let's revisit the age groups. How do they approach treatment for the puppies for juvenile vaginitis?
Right. For juvenile vaginitis, the approach described in the sources is mostly conservative management. Good hygiene, gently cleaning the area is important, but often the main treatment is simply patience.
Waiting it out.
Pretty much, because it so frequently resolves on its own after that first heat cycle thanks to the hormonal shifts. So systemic antibiotics are generally avoided unless the case seems unusually severe. The idea is to let the puppy's system mature naturally.
And the advice is often to hold off on spaying until after that first heat, if possible, for this reason.
Yes, exactly. Allowing those natural hormonal changes to happen can be the key to resolving this specific type of puppy vaginitis.
Okay, patience for the puppies. What about when they've confirmed it's bacterial vaginitis in an adult dog?
In that case, systemic antibiotics are often necessary. But, and this is a huge but stressed in the sources, the choice of antibiotic absolutely needs to be guided by those culture and sensitivity results. You use the drug that you know will work against the specific bacteria involved.
And it might take a while.
Yeah, treatment courses can sometimes be several weeks long, but again, even while treating the infection, the sources constantly remind us that addressing whatever underlying cause allowed that infection to happen is critical to prevent it from just coming right back.
So going back to the example, if the bacteria were thriving because of a recessed vulva, you can give antibiotics, but you also have to deal with the vulva itself.
Precisely. For those chronic problems caused by anatomical abnormalities like a recessed vulva, while keeping it clean and maybe weight loss can help manage things, surgical correction is often needed for a permanent fix if conservative measures fail. That procedure is called a vulvoplasty or sometimes episioplasty. It basically reshapes the area to prevent that trapping of moisture.
And what about strictures or foreign bodies?
Those almost always require intervention. Surgery to remove the foreign object, or to surgically correct the narrowing, like resecting a stricture or dilating it.
And if the vaginitis is secondary to a urinary problem?
Then you target the primary issue. If there's a UTI fueling the fire, you treat that infection properly, again, based on culture results. If urinary incontinence is the culprit, then that condition needs specific management.
What about tumors?
For vaginal tumors, surgery to remove the tumor is usually the main treatment, and spaying is often recommended alongside that, especially if it's a type of tumor that's influenced by hormones.
Are there things owners can do at home to help, like supportive care?
Yes, definitely. Supportive care measures can make a difference. An Elizabethan collar, the cone of shame, can be really important to stop the dog from licking the irritated area, which just makes inflammation worse or can lead to self-trauma.
Good point.
And if the dog seems painful, the vet might prescribe pain medication for comfort.
Now, you mentioned spaying earlier regarding juvenile cases, letting them have a heat cycle first. But how does spaying fit into treating adult vaginitis?
That's a great question. The sources point out that while spaying isn't usually a direct treatment for an acute first-time bout of vaginitis, it can be incredibly helpful, sometimes curative, for chronic or recurrent vaginitis in adult dogs.
How does that work?
By removing the ovaries, you eliminate the cyclical hormonal influences that, in some dogs, seem to contribute to the inflammation or changes in the vaginal environment that allow problems to persist. Plus, as we touched on, it completely prevents pyometra, a potentially life-threatening uterine infection that can sometimes present with similar signs.
So for those stubborn, recurring adult cases, spaying can be a really valuable part of the long-term solution.
It certainly can be. And managing recurrence is a big theme in the sources. Owner compliance is vital, sticking with the hygiene recommendations, giving medications as prescribed, following post-op instructions if surgery was done. They also list a few things not to do, like demanding antibiotics without a proper diagnosis and culture, because that can just mess up the normal flora. And definitely avoiding things like vaginal douches, which are usually irritating. They also caution that using corticosteroids might suppress inflammation, but could mask or worsen an underlying UTI.
Okay, that was incredibly thorough. It really paints a picture of vaginitis as something that isn't always straightforward. The signs might seem obvious, but figuring out the actual cause is absolutely the key to getting the treatment right.
Absolutely. That whole diagnostic process we walked through, the detailed history, the careful physical exam, the critical role of vaginoscopy for visualization, plus cytology, culture, checking the urine, maybe imaging. That's what lets the vet connect the dots and create a truly targeted plan.
And understanding that process the different possible causes from anatomy to infections to foreign bodies, and the tools the vet uses that really helps you, the listener, understand the conversation with your own vet if this ever comes up. It explains why they can't just glance at some discharge and hand over pills. It's about finding that root cause.
It really does. It highlights how interconnected everything in the body is. It kind of makes you think, doesn't it? How inflammation in one relatively small area like the vagina can actually be a signal, a symptom, originating from issues completely elsewhere, maybe related to the dog's overall build, her urinary system or hormonal state, or even something accidentally lodged inside.
Yeah, it really underscores how complex these biological systems are, even when dealing with what might seem like a minor issue.
Thanks so much for digging into all this with us.